Introduce ourselves to everyone else in case we have forgotten the names or you are new for the meeting. And before you do, you just press the mic here and speak into it. Also, a small warning that this meeting is going to be recorded, so it's possible camera might see your laptop, so you have to exercise some discretion. Okay? Right, so I am Paul Egil-Shelvan, Councillor for Cramlington South East, and I chair this meeting.
Good morning, everybody. Graham Sizer, I'm a GP in Alnwick. I am a clinical lead for the North East North Cumbria Integrated Care Board, to give it its full title, in the local delivery team for Northumberland and North Tyneside.
Hi everyone, I'm Tammy Smith, Public Health Principal at Northumberland County Council, here deputising for Jill O'Neill today.
Hi everybody, I'm Councillor Eve Chicken, a Cabinet Member for Adult Social Care and Health. Thank you.
Yeah, good morning everybody, I'm Kevin Waring, Police Superintendent for Northumberland.
Hi everyone, Neil Bradley, Executive Director for Adult Services at the Council.
Good morning, I'm Debbie Nugent from Health Watch Northumberland.
Hello everybody, I'm Hugh McKendrick, I'm the new Chair for Health Watch Northumberland.
Hi everyone, I'm Sam Anderson, one of the Service Managers for Grow and Healthy Note 19 team.
Good morning, I'm Laura Jobson, Associate Director with CNTW, here deputising for Chloe Mann this morning.
Morning everyone, I'm Vicky MacLeod, the Director for Children, Young People and Families at Northumberland County Council.
Good morning everybody, I'm Rob Clow, Area Manager for Northumberland Fire and Rescue Service, representing the Chief Fire Officer.
Morning, I'm Janet Harris, Deputy Director for Delivery in North East North Cumbria ICB, here on behalf of Rachel Mitchison.
Good morning, I'm Alan Smith, I'm the County Councillor for Cramlington Eastfield.
Morning, Ross Wigham, Director of Communications and Engagement at Northumbria Healthcare.
Yes, apologies for my tardiness. Abby Conway, Chief Exec of Citizens Advice, representing the voluntary sector.
Nicola Duffy, Programme Director, Thriving Together.
Nicola Turnbull, Democratic Services Officer.
Hugh, you are joining us for the first time, I suppose, so please welcome. We look forward to hearing your contributions now and also over the period of time. And apologies for absence.
Good morning all. We have apologies for absence from Councillors Carl Green, Glenn Sanderson, Jill O'Neill and Chloe Mann.
Okay, thank you. So shall we agree the minutes of 10th of April 2025? Any corrections? Yes? Okay, thank you. Disclosure of members' interest. Does any member have any interest to disclose? We have two items, Thriving Together and Health Watch Annual Report. Any conflict of interest? Nothing declared. Okay, so let me welcome Nicola Duffy, who is going to give us the annual review of Thriving Together. Yeah, so would you like to start, Nicola?
Yes, thank you, Chair. I take it I'll just move it on. Yeah, there we go. So thank you all for inviting me to come and provide the annual update on the Thriving Together contract. We've been commissioned as the voluntary and community sector support since 2021, and we've recently secured a 3 to 5 year contract to continue this work and build on our success with the sector. And just a reminder of our aims and missions. So firstly, making sure the smallest voice in the third sector is heard by developing strategic links at a local, regional and national level. And building the capacity of the voluntary sector by acting as a conduit to funding, training and other tools to help the VCSE thrive in Northumberland for the benefit of its residents. And our aim is to be a trusted source of local support, championing long-term positive change for volunteers, organisations and the people they serve. Oh, away. That's it. So how do we go about this? So firstly, our communications, which are crucial for providing guidance on governance, ensuring organisations are operating safely and legally, details of funding opportunities and sharing of information. And you can see there, central to this is our website, which has had over 3,500 new visitors in the last year alone. We have our bi-monthly newsletter, which has 619 subscribers and is sent to all parish and county councillors, and it's a great way of sharing updates across system partners. In our quarterly networking events, which are rotated across Northumberland, and we've held 4 in the last year in Morpeth, Newbiggin, Long Houghton and Newton and Bywell. And 330 individuals have attended at least one of those events in the last year, with 108 separate organisations represented. We keep them deliberately very informal. Guests are provided with a list of expected attendees so we can facilitate those targeted conversations, so making them a perfect opportunity to meet contacts, share ideas, information and start collaboration. And I'd just like to share a quote from a recent event from one of the attendees, who said, "Another fantastic event that is conducted in a way that feels informal yet welcoming, with a shared vision to build upon assets in Northumberland by connectivity. Thank you and well done." And our community connectors, who are wonderful, and you can see a lovely picture of them here taken at Alnwick Garden. They are our boots on the ground, so they make the one-to-one visits with organisations to provide that support and guidance. And after making 300 introductions between partners in the last year, we've had some lovely notes of thanks for their enthusiasm, but mainly for the usefulness of the leads that they've created and how much work that saves the sector through having those ready-made links available. And just a couple of examples I'd like to share. So after we made the relevant introductions, Phil from National Trust at Wallington Hall hosted 3 staff from Wansbeck Community Links, and they discussed programming activities for their client group and also volunteering placements. And afterwards, Phil said, "This feels like there are lots of possibilities here for programmes for their clients and also volunteering within our organisation. And without our intervention, those organisations would not have joined forces and those opportunities wouldn't have been created." And another example, quite small example, but the of community connectors just helping that work across Northumberland. Helen met Heppel Estates, who had some funding to allow them to offer free tours and outdoor activities for VCS organisation. So Helen identified that Blythe Star Enterprises, who are a local charity who support adults with complex mental health needs, would really benefit from that introduction. And as a result, Heppel are organising a trip for those Blythe Star users, which will include a tour of the site and other outdoor activities specifically aimed at improving mental health. And Maria has been working with one of the locality coordinators, Michelle and Sue Boyd from Recovery College, to organise a health and wellbeing event in Amble, and that's following feedback from the sector that there was a need to improve communication between partners and residents in that locality, so they're having a dedicated day for that in September. And then our employability project, Solid Foundations. And we've been leading this since 2023, and that's through funding secured from the Combined Authority under UK Shared Prosperity. And it focuses on those who are furthest away from the job market, so those economically inactive residents, and we look at removing barriers to progress them into volunteering, training or employment. And we brought together a partnership of 6 organisations, and so far we've helped 270 participants, with financial and mental health support being the most needed interventions. And from that, we've managed to get 32 people into employment and a further 45 into education and training, which I think is quite impressive considering, as I say, these are the furthest away. And our latest project is our Volunteer Passport. So this is a digital tool which helps volunteers record and showcase their training, skills and experience, turning their valuable volunteering work into recognised personal and professional development. And the pilot has been really well received by grassroots organisations, including Healthwatch, who were part of the pilot, who are really benefiting from the easy recruitment process, real-time communication tools and reporting capabilities, which captures that invaluable contribution of volunteers. And then there's just a slide there about our reach. We really do the miles and travel throughout Northumberland, providing support up and down the country, up and down the county rather. And we've made 392 new connections in the last year. And one of the ways we achieve that reach is through our Thriving Together networks. So following the renewal of our commission, we refreshed our networks based on feedback from the sector, and we now have 15. Each network either has a geographical connection or a common theme, and it's run by a lead organisation who facilitates at least 4 meetings a year, exchanges information with members and provides strategic representation. And this allows us to ensure that information is passed down to network members, but also crucially that they're able to feed up their views on policies, strategies, consultations, challenges, gaps in provision, etc. through those leads. And we hold quarterly meetings for the leads to provide their network updates and discuss potential cross-network collaborations. And in the last year, we've successfully launched the Veterans Network, which now has over 90 members. We've already facilitated 3 meetings of the new network, and that helps strengthen collaboration between those really grassroots organisations who are providing vital support to the county's veterans. And part of our role is the promotion of Frontline, which is the digital health and wellbeing referral platform. And in the last year, we've seen significant increase in services registered and signposts made. Nearly, over 26,000 signposts made in the last year, really helping connect Northumberland's residents to the support they need. And then the feedback that we receive via our networks, via our events, via those one-to-one visits, we then take into multiple steering committees, groups and forums, and all the ones that you can see there include Thriving Together representation. So we either chair or are members of 18 different groups currently. And that's things such as the Inclusive Economy Partnership, Poverty and Hardship Group, Frontline Steering Group, through to more themed groups such as Tobacco Control and Drug and Alcohol. And one of the most successful ways in which we've supported the sector is as a conduit to funding. And just a reminder here that in the last 3 years, we've achieved £3 million investment into Northumberland VCSE from a variety of sources, from Combined Authority, NHS, ICB and private business. And that's had a huge impact on the ability of the sector to expand its delivery into such things such as adult education budget, which was community-led training, and the Multiply project, which was focused on basic numeracy skills. And as Thriving Together, we have the infrastructure to act as lead accountable body to identify funding opportunities, bring partners together based on their individual strengths, develop realistic delivery models and complete thorough applications. The result of this is that there's access to larger pots of funding which can be distributed through us to smaller grassroots organisations to allow them to deliver the hyper-local activity where it's needed in the county. We've also designed and developed grant processes from application right through to evaluation to allow us, and this has enabled us to work with the sector to identify where those gaps in provision are and fund innovative projects designed to address inequalities. And our touchpoint meeting with NCC is via the VCS liaison group. The core members are made up of cross-party elected members, senior NCC officers and ourselves as VCS representatives. And they're held every 2 months, and we jointly draw up an agenda based on feedback from the VCSE and invite representatives from the sector to come to meetings and discuss the issues they've raised. And there's also an opportunity to invite representatives from the VCSE to showcase the valuable contribution they're making and any collaborative work. And in the last year, we've covered topics such as co-designed welfare benefits training, pension credit campaigns, impact of the collaborative LIFT campaign and the power of the Thriving Together networks. And we look forward to the first meeting of the newly formed membership this afternoon. And that's just a slide I mentioned before, our networking events. Just to plug that our next one is being held at the Family Hub in Ashington on the 21st of October. We only opened bookings on Monday and we've already had 74 people confirm attendance, so just to show the scale of those events. So what's next? We've now got the benefit of the longer term commission, so what's next for Thriving Together? So the volunteer passport, this has become a key piece of work for us, and we'll continue with the pilot, onboard more organisations and establish an action team of volunteers who, once registered, can move between more easily, to provide them with a variety, but also further opportunities for organisations. Communities First, I'm co-chairing the commissioning and volunteering work streams, looking at drawing up processes to distribute micro-grants to the sector to support them to enable the Communities First approach, whilst looking at how we can further harness the volunteering capacity in the county through the passport, but also through a new social value tool, whilst also ensuring that the VCSE has access to the training they require to upskill their workforce. And as a conduit to funding, we'll continue to look at funding opportunities wherever they arise to bring together delivery partnerships, ensuring that we receive the benefits for our Northumberland residents. And we recently worked collaboratively with Regen on a bid for Connect to Work through the Combined Authority, which was successful and due to start this September. And continuing to build on that strategic relationship with NCC and others to influence and amplify the voice of the sector, providing that representation at the highest levels. And HAF development, we've recently employed an additional community connector, Hannah, and she's working with those VCSE organisations who are involved in the holiday activity and food provision programme. So that's activities for those children eligible for free school meals over the summer and other holidays. And this will result in a new HAF providers network to be launched in the autumn. And we're also really excited to trial over the summer a pilot for HAF Plus accreditation, and that's for young people over the age of 13. So there'll be lots of people celebrating, lots of young people in the area celebrating great A-level results today, and that's fantastic achievements, and they've worked really hard. But we know there's other young people who don't benefit from having that perhaps academic ability, and it's looking at different ways in which they can showcase what they've achieved through their volunteering. And the young leaders work towards a certificate which records those skills and knowledge, and just helping them, as I say, provide that record of the achievement. It's a small pilot to start off with, but we think it's really scalable, and there's potential links to the volunteer passport. So we're very excited to see how that develops over the summer and beyond. And then just my last slide there is a picture of the whole Thriving Together team, which was taken at our last event. They all work really hard to make sure that we support the VCSE in Northumberland, and all of our achievements are a credit to them. Any questions?
Thank you, Nicola. Thank you very much. I think Thriving Together is one of the best strategic investment we made in the 4 years, and it's nice to see this unfolding and multiplying multiplying the effects. It's really good. So, are there questions for Nicola?
Put that on. Thank you. A really concise presentation, and so that's great for Health and Wellbeing Board. But it must be really difficult to get the breadth of what you do into, what was it, 6 slides? I don't know. So well done for that. There's 3 points I just want to bring out. One is, if you think back to our work when we did the inequalities side of things, and our knowledge that there are great inequalities across Northumberland in our communities. And if we take that through the work we're now doing with the Institute of Health Equity, and the work around getting people into economic activity, that brings us directly to the volunteer passport and how you can take people in that challenging environment that they're in and draw them into feeling that they have a value and they have a worth, and getting everybody to see them. So that's just kind of a direct link over the last few years.
Yeah,
so that's really good. The stakeholder slide, I think, just shows the breadth of the organisations that you need to feel you have a connection to, which must be a real challenge. And I suspect understanding what's going on in each of those little bits and having that kind of helicopter view must be difficult, and you're just going left, right and centre all the time. But it was just to acknowledge that, because it just shows us where the voluntary sector needs to have a reach. And yet, not many of those organisational bits are you chairing, or are you doing those bits in? You know, it's kind of come along and listen, but making your voice heard is really important, and you do that. So thank you. And then on the future bit and stakeholders, in health, we have a lot of rhetoric around integrated neighbourhood health. And there's actually quite a movement in Northumberland where primary care is bringing itself together to consider how that could work for Northumberland. And I know they're working with NCC closely on that, and I know you're involved in that too. but that is where you just need to concentrate a bit on your strategic relationship as well. So we need to keep you in that loop, and I hope you are. Yeah, thank you.
I completely agree, Graham, and thank you very much, both Paul and Graham, for acknowledging that. Certainly around the neighbourhood health, yes, you know, we think, I think it was quite stark for all of the areas that had to come together quite quickly at a system level to put something together, and the fact that so many of our local neighbours couldn't do that and chose not to do that, I think was quite telling of actually the maturity of those relationships, a lot of which starts here and actually transcends out, that we were able to, and you know, Thriving Together was talked about in the bid that went forward, but also Nicola's now been engaged in the No Place Like Home Transformation Board to look at the Thriving Together piece around the Lintonville group and all the rest of it. So it is constant. It's constantly needing to understand what everybody else is doing so that we can make sure that the point of it is about having the voice, not my voice, not Nicola's voice, but the voice of the sector, to understand what that implication has. And the thing that we got across mostly when we talked about the neighbourhood health was, please don't build another infrastructure. Let's use the assets that we have. Let's use the things that are strong already, and then let's build health around it rather than creating it separate. And I think that's the tone that we need to, and it's kind of what we've started here in terms of, it's not who you're working for, it's what we're all working for. So thanks.
Thank you. Less of a question, more of a comment. I take particular notice of anything that involves veterans due to my family circumstances and also what I do for work. I'm always impressed when I see something that ties ends in together, because I know from what I do that the NHS is trying, the DWP is trying, the veterans associations are trying, everybody's trying to do something, but quite often the ends just don't all tie in together, and it's sort of a little bit mismatched. So when I see something like this really trying and actually succeeding to do that within our local authority, it is very impressive. So as the soon-to-be wife of a veteran, thank you. Secondly, I just absolutely love this passport. I love the idea of it. When we talk to people wanting to get into the sector, wanting to try something new, maybe even getting into work for the first time, a lot of what they say is, I'm trying, I'm applying, but I keep getting back the same thing. I don't have enough experience. How do I get experience if I don't have a job? Yep. So volunteering can be the first step to anybody getting a job. If you've got a passport, a digital passport that can say to a potential employer, I've done this. This is my experience in real time. I've worked with this part of the authority, that part of the authority, this volunteer sector, wherever it may be. My goodness, does that not look good? That is a digital CV right there that opens doors for people and also for potential employers, because you're looking at what you can bring on board that is always going to benefit you. So to tie all that into this passport and to really encourage the next generation of workers, that doesn't have to be youngsters, it can be anybody, people changing career path, and we really want that. So this, I think you should be so proud of this. What a good idea. And to be able to roll this out through the authority is just tremendous. So thank you for that.
Thank you very much. Yes. That's really kind. Thank you.
Any other question from the floor? Yes, please, Neil. Yeah.
Yeah, thanks, Chair. Just a bit of a sense check from me. I know from what you've described, you'll have really good links with public health, communities first, etc.
Yeah.
But just, you'll be picking up a lot of intel through the interactive work that you're doing. And coming from a core council service perspective, I'm kind of thinking housing, I'm thinking children's services, and for me personally, adult services. Do you feel like you've got solid roots into those core functions to be able to offer feedback? Because if not, I'd probably quite like some of my team to have a conversation with you about how we could strengthen that, because clearly there's a lot of material here that would be useful to us in terms of intelligence.
I think that would be great. We did start off very public health focused, as you say, but then through Communities First, we've made some connections with adult social care. Through my work with the Inclusive Economy Partnership, that's how we then made those connections with Regen. So yes, that would be, great to have, more connections with different directorates, because, as you say, we do work with lots of different organisations which cover, their sort of theme would cover the different directorates. So yes, absolutely.
Yeah. That will be very good, Neil. Thank you. Yes. Any other questions from the floor? Yeah, I have a few questions. In fact, Neil alluded to. So you have completed 2 years, is it, Nicola?
It's
3 years.
3 years.
2 more years
yes.
to go.
No,
Oh, 3 plus 2.
Yes.
Okay, 2 more years to go. Right. Okay. No. 5 years. 3 plus 2. Okay, sorry. Right. Yeah, I lost track of time. So time flies so quickly. Anyway, I'm sure you must have, felt, faced lots of difficulties in the initial period. What I would like to ask is a very fundamental question in a way. Neil alluded to that one. Is there any way we can help? Are there still difficulties which are quasi-permanent or something we can do?
I think Neil just alluded to that. It's about spreading that across the whole of the local authority.
Yes.
If I use the example, we've just been talking with some regen colleagues about the Wansbeck Square development and what happens next. And the discussion was, well, we'll go out to speak to the local community or the local voluntary sector, and it's like, you can use us for that. That's what we're there for. Yeah. And it's just, it's not a resistance. It's just an understanding. And you saw the team on there, and I know I speak for it because I'm in a lot of those conversations, and I'm not technically on the team, but because we have oversight of it all. There's only 6 people. It's a very small team, and its impact is quite big. But actually, we just need to be in more places and helping more. So yeah, spreading, just remembering that Thriving Together is there as a conduit. So if you want to speak to the voluntary sector, just like if you want to speak to, People Health Watch would be where you would go to. If you want to speak to the communities directly or people affected, it would be Health Watch. Again, if it's the voluntary sector, it would be Thriving Together. So if we can get that message out, that would be wonderful.
So what should we do to help that message?
Well, keep thinking, you've already got a mechanism. Yeah. So again, it's like, let's not try and reinvent the wheel. Let's not kind of think, right, what we need to do is go out and ask somebody else to do that. You already have a vehicle for it. You've just commissioned it for 5 years. Use it. I mean, Nicola's perfect example is co-chairing the Community First the small grants thing. It's and again, with Connect to Work, we want to work as a vehicle to help move things on. And if there's a blockage, then just think, contact Nicola.
Okay, right. Yes. Andrew, thank you. The mic. Yeah.
Thank you. So I'll happily take that action, particularly around how we could do much more. So what has been talked about are some really good examples where there are some good connections and we can see impact already in the council. So if you think about the Connect to Work, the skills work, the employability work, and you're right, I think we could do much more. So there are ways in which we can do that, which is an awareness raising through things like our corporate briefing. I think this would be a brilliant presentation actually to come where all the senior team across college. So Neil and I can pick that up and take that away around how we help to, I'm going to use the word infiltrate that into more of the organisation, absorb it more within the organisation, I think. But actually, in each of our executive directorates, there are opportunities where we would be using the communities first approach and we'll be reaching out, and it should become over time much more of our language to say we'll use Thriving Together for that, we'll work with Thriving, we'll talk to Thriving Together and get that advice rather than think about, scratch our heads and think, where do we get that from? So it's a piece of work over time, there is no doubt about that, but we've got some really good examples with good impact already that we can use, and that's always you're in terms of those conversations, so we can do that pretty quickly. But Neil and I'm committing Neil to that as well. I'm sure we'll take that back to our colleagues and take that forward. There you go. To present.
No comment.
Yes, please.
Yeah, thank you for that. Just from a fire and rescue service perspective, and yes, we are part of the county council, but I think there's scope for us to be involved as well. I think some of our prevention team might already work with the community connectors, but I'm thinking about, the VCS being totally aware of the service that we can offer to their clients in terms of safety in the home, but also from an education employability perspective as well. Some of the youth engagement training programs that we deliver, I think that if some of your organisations were aware of those, they could be promoting them to the customers. So, yeah, very, very happy to get involved. Is that whether it's via Audrey and Neil or directly, I'm easy either way.
Yeah,
Just
I think
keep
it
us
would,
in the loop, please.
it would be great to make that direct connection. I think especially around the employability stuff, and obviously, as I say, with the HAF pilot, that would be brilliant. Thank you.
Great, thank you.
Any other questions, suggestions? Okay, thanks for the help. I think there are quite a few offers you have now, so I think thank you very much. So as a board, we are supposed to review the presentation and take on the recommendations. So can we agree the recommendation? Yeah, thank you. Thank you very much again. Now we move on to the next item, Health Watch Annual Report. It's a joint presentation. Oh, yeah. By Derry and Hugh. Yeah.
The welcome and inclusion that we get as Health Watch. Probably worth starting off, if I can. Yeah. Just reminding everyone about what Health Watch is and why it is. We are a creature created by law. We were created by the Health and Social Care Act in 2012. And the word that has been used has changed slightly over a few years, but this word championing has always been in there. We are described as the champion for people who use health and social care. And when you think about it, that means all of us, because all of us in some way use health and social care. So we are your champion, we're the champion for everyone in Northumberland, we are just your champion, and that's the way to think of it. And that's why I like that particular picture. I mean, what else could we have in Northumberland but that particular picture? But what championing means, I think, is quite difficult, because it sounds like the picture, very sort of like athletic and whatever. But in our context, what we always say is that it's about encouraging health and social care services to step back. Both of those areas are data rich, and things will always be led by those things, and that's absolutely right at the levels that you're working. But our role is to help and augment that data and get services to step back and say, but this is the experience that people have had in your services. And I can see Laura and I can see Ross, and I know that the conversations we've had with both you as trusts over the years, I would hope would reflect that. And it's that stepping back to see the bigger picture. I think this next point about creating empathy is really important as well, because I think in Northumberland we do have that real at the heartbeat of what we do, I think, in services is about people and that empathy and that human understanding. And as I say, I think that's where we go with bringing something more than data. But it also takes time. And I think that's the thing that I would always say to people, that any change that we can bring and help services do always takes time, and we understand that. We recognise the constraints that you're working under. But actually, for the people who tell us the things and share their experiences with us, it's probably the most frustrating thing. And I think if you look at our report, you'll see where some of that frustration is particularly focused. But I think one of the things that I would hope we've tried to bring to the table in our conversations with all of you is that you are the decision makers around these things. You are the people that make decisions either within your trusts or in ICB level. And we would hope that the information that we bring can help you make better decisions, because I think we'll all agree the rounder, the more information we have, the better your decisions that are made. So for us, that's what being a health and social care champion means. And I hope you recognise that in the work that the team does. Go down. Yep, there we are. So that's the things that the Health and Social Care Act says that we have to do. So they are set out in the Act. And there was actually another one which was separated out, which was around NHS complaints advocacy, but that sort of floated off a little while. But these are the things that have lasted the distance. And hopefully, again, you can see in all the work we do where we deliver each of those areas. But the golden thread that links all of those things is that we only do those things by gathering evidence. So our whole point of Health Watch is to gather patient and service user experience. Because if we don't have that, it's just our opinion. And as you've all heard me say before, I'm completely happy to give you my opinion about health and social care, but that's not the point, and that's not why I'm paid. I am paid to bring you the views and the experience of the people of Northumberland. And I thought, again, hopefully, when you look at our reports and the work in the annual report, you'll see that golden thread. So that's who we are. We are 6 members of staff, 12 board members, of which you is our new chair, and 12 volunteers. I was struck when Nicola was doing her presentation about just how much we as two entities create and what we do and what we accomplish with such small dedicated teams across the vastness of Northumberland. So I'm just very, very struck by that. So yes, so that is us. So you've hopefully all had a chance to read our report. Hopefully it shows how we have fulfilled our statutory functions, and obviously we're happy to answer any questions on all of those and any of the work highlighted. I think one of the things that the feedback from patients and carers epitomises more than anything, and I think this becomes more relevant as we go forward, is that not everyone can speak up. Not everyone feels that confident to speak up about what happens to them when they use one of your services. And I know you've all got brilliant feedback mechanisms, and you've got friend and family tests, and you've got all of these ways, but we know, because we are told on a daily basis, that people do not feel comfortable using those. And I think that is both a really sad thing, but I think it's also an area that we can all reflect on and work on. But I think it's really, really important that we remember that actually having someone who is not going to make a decision about your care listen to you is really important. So, the projects we've done this year, as you'll see in the report, audiology has been our big one. And I think this, again, it comes down to that thing where people can say something, but it takes someone else to say it with them to actually get change done. And audiology was one of those where, not to put too fine a point on it, audiology services being provided by Newcastle hospitals were not serving the people of Northumberland. And it took a long time, because we obviously had the pandemic and other things and everything else going on in the NHS, to get to a place where an improvement plan was put in place. And that improvement plan is now in operation. And, you know, we thank Newcastle hospitals for the positive way that they engaged around those issues. But we need to see that they are delivering. We need to know that they are actually working. So it was really good. We're really pleased as a plan, but we need to know that it's happened. The thing that we were also very excited about this year was the young people's mental health in schools, which I know Audrey would be very excited about. But this was brought to us by a young student in a high school in Hexham who said he really wanted to do something with his peers. And we gave them some support, and we helped them think through some of the issues, but basically designed this project, ran this project, did all the analysis, did the survey with their peers and with parents, and wrote it up. And it's a fantastic piece of work which we're looking to extend into other schools this year. And I'm looking at Audrey because what can you do coming from this meeting? That would be one of the things that I would say. we would like to do, because it was such a positive experience. The other things we did this year, the enter and view visits to care homes, which I know Neil will be very keen to be about. We visited 4 care homes, and I know, Councillor, when we were overview and scrutiny committee, you brought up the issue about care homes, and I think, again, it's something we're very keen to hear. We do not, it's not an inspection, because no one go away with that sort of thought. It's not an inspection. We and Hugh came to one of the visits with us, did one of the visits. We don't inspect, we're not the CQC. We go in there as a lay perspective, and we go in there from the perspective of saying, if I was looking for a care home, what would be the questions I would want to know? And we do that report, and we can help that service maybe look at things they haven't thought about, but primarily we're providing that better information again to the general public. The other piece of work we've done as well at system level, we work with the ICB around some of those things, and we've just done a piece of work with Northumbria about their new front door, which was in the Times, I think, on Sunday. So being, I think it's the feedback we'll give you, I think we have given you on that, is going to be helpful, one hopes. But I think one of the things that people forget about Healthwatch is that one of our statutory things that was up there on there is about giving advice and information, or information and signposting, I should say. Don't use the word advice. Sorry, Abby. I know better. You know I know better than that. Signposting and information. Because one of the things that we always remember, and I know Abby will agree with me on this, is that every question we are asked about a service, from where can I get, what do I do, how do I do this, identifies a gap in your service. And I think it was really interesting this week that we were engaging with a group of people up in Amble with early dementia and cognitive impairment, and we were talking to them about where they would find help. And the vast majority of people in that group did not know about One Call. So as a council, One Call is your front door, isn't it? It's the thing that you do. But they didn't know about that. Didn't know about what services get, didn't know about that. And I know Neil's, that's probably, you're making a note, Neil. Absolutely. And for us, that was quite telling, because it's about what information we can help people find, but I think it's for other services as well. And as we're saying, how can we join all of that up? Because those people need those services, but weren't able to understand that, where to find it, and I think that was important. So that was last year, and I'm happy to answer any questions on last year's projects. So you may have recognised these, and if you don't recognise these, then do get some more copies. These are the things that should have been whizzing their way into your inboxes, or any of the drop-ins that we do. But if you want any of our reports, they're all available. You can get hard copies, or we can email them to you. So what are we doing this current year? So 25-26, we're a quarter of the way through the year. Very excited about persistent physical symptoms. This is a piece of work where we're working with Northumbria Healthcare and Northumbria University, and we are leading on the patient involvement aspect of it, where people who have persistent physical symptoms that have not had a diagnosis, but where it's impacting on their life and it edges over into that whole employability area. It's a 3-year project, so we're very pleased to be doing that, and it's centred on Blythe. So again, I think it's going to be a really enriching piece of work that will tell us a lot about services and how people are experiencing services and what they need to actually help them get to the next stage of their life. We're doing more enter and view visits. I'm talking a lot about Blythe because we're actually doing the next lot in Blythe, and the reason we're doing that is that last year we did the visits by provider, so we visited homes by one provider. But this year we thought, well, let's look at a locality, because if you're looking for a care home, you look where you live mostly. So let's look at a locality and let's look at the care homes, and let's this year look at maybe ones provided by smaller providers. And I think that it's about that us understanding people's experiences across a whole range of different services. We're also looking at respite care and access to that, because we've got a live survey at the moment, and if you've not already got that in your inboxes, do get it, do promote it, send it out to people. That's a really interesting piece of work, because it's one of those things, through our annual survey and through our general engagement, it just bubbles up every now and again, even though I know Adult Social Care have done a lot of work around that issue. Digital access to GP services. This comes up all the time, absolutely, and I know elected members in the room probably have the same experience. Digital access is good for the people who it's good for and who can use it. But we are still getting a lot of people saying they are having problems and they feel that it excludes them. So we're doing a piece of work on that at the moment, just to try and understand people's experience. And what we're trying to do from the perspective is trying to work with practices where we're getting good feedback, so we can understand what they're doing right as a way of promoting it, I suppose. And I think that's really, really important, that we work from a position of strength and not always deficit. Dentistry, there is a recovery plan. There is a national recovery plan now, but we don't know how that's going to figure out and how it's going to land in Northumberland. So we are going to keep up very, very close and very active interest in how that actually works in Northumberland, because we know that we were particularly hard hit in places like Berwick when NHS dentistry withdrew from there.
I would just say to the audience, the three pieces in the middle there that Derry's raised are the greatest responses in our annual survey, which we had a huge response to this year. But also in all the monthly data we get, the same three things keep coming up. And even when we whittle that down to sort of local areas, it's still the same three. So the piece around respite, digital access to GPs and dentistry are repeatedly being told to us as major concerns. So they're a really important sort of centre of the work that we're going to do over the next year in terms of listening more.
Yeah, absolutely. And the less heard communities, again, I think it's really important that we just have the most general, widest ear that we can have, but we also have that very targeted ability to listen as well. And again, when I was listening to Nicola, I was thinking about some of the lesser community stuff that we're doing around drug and alcohol. We'll probably link again with you on that, because again, I think that's one of our focus audiences this year. So that's mental health services in different areas. In the annual survey again came up where there were people with different areas of the county, their experiences of access to mental health services or their experience were different, and we're not sure why. So we're going to go and ask why, basically, so we understand that and we can then pass that back. But again, we're just not. It was a surprise result from the annual survey this year. So that's our 2025-26 projects. Always plug how you or anyone promote this can get in touch with us all these ways. We are out and about across the county all the time. You know that we're based in Hexham. I never see the team because they're always out in the county. Online, telephone, anyway, all of those ways get the information to us. And I would ask you, as the Health and Wellbeing Board and as community champions, to promote and direct people to us. So what else can you do? You can also promote volunteering with us. I think you'll see in the annual report about young Matthew, our student, who's probably got amazing A-level results today, I should imagine. But whoever you are, volunteering with Healthwatch has great benefits, as all volunteering. And we have such a different way of doing stuff that sometimes people are surprised about what they can get out of it. So do get in touch with us and do promote it as an opportunity for people. So I'm going to leave it there. The last comment I'll make is that you know that change is coming for Healthwatch, but what that means we don't know yet, but I'm happy to answer any questions you may have on that. But I'm really happy to answer the questions about the work that we have done and are planning to do.
Thank you very much, Derry. Thank you, Hugh. Any questions for Derry and Hugh?
Ross first.
Ross, yes, please. Yeah, Ross, Neil, and then you. Okay.
Oh, thanks for that, Derry. And I know we've spoken about this outside of this really, really good piece of work. And I think we're right to say it's a real time of change for kind of all of us, I think. And probably a lot of that intelligence and engagement's even more important in times like that. So just to see a lot of the success of it, I think, has been around relationships and in our area, particularly, just to say that we have a really strong relationship with both our health watchers, and the intelligence and advice they've been able to give us has been really valuable, particularly on things like audiology, which were covered there. And I think one of the other positives is the things that do keep coming up are things we know are an issue and we're determined to sort of improve. Sometimes it's beyond the levers of our control and it'll be a national thing, but that notwithstanding, it's good to keep that conversation going, and we really appreciate all the time you spend doing it and attending our event and us coming to yours. And I think that's probably the key to it, and that lack of sort of adversarial element, but being able to have those sensible grown-up conversations about difficult issues as well. So thanks very much.
Thank you.
Neil, please.
Yeah, I mean, it was just to add a little bit to what Derry said for the board. I mean, it might have come across a little bit in some of what you said, Derry, there, like you go away and work your work programme up, which I know you do based on the feedback that you get. But I was just going to add, there's a lot of dialogue between us where we have the ability to bring forward issues that are hot to us as well, that we want opinion on, we want feedback on, etc. I mean, the biggest success over the last couple of years has been the People's Experience Working Group, which you set up for us, you run for us, and is now actually probably what key co-production resource that we're using as an adult social care department to try and get feedback as we're looking at policy change and things like that. I mean, I am a self-declared objector to, I think, what was announced a few months ago. It feels like our relationship has blossomed post-COVID, and I hope in whatever does come next, we can maintain the same sort of relationship with whatever body it is, in whatever form, to get that sort of, that independent voice is so important, you know. And if we can make the links, as I say, on the Thriving Together side as well, I mean, we are getting hammered as adult social care departments through the inspection process that we don't do enough around co-production, we don't do enough around involvement, we aren't listening to the people's voice enough. We're trying now to do it in Northumberland, and partnering up is the way to go with it. We can't do it ourselves independently. So a big thank you for that, because it's been a great couple of years. So.
Thank you.
Thanks, Derry. Just some really positive things. I know you came to our system board and we talked on the audiology side of things, and you came at that with a very constructive eye, and I think views can often become quite polarised, and actually I think Health Watch does play that role of being balanced in the system. I am the only primary care representative in the room, and I am going to say something about digital access. It's interesting that I would consider myself a relatively balanced member of the primary care profession, and yet when I hear some of the talk around the difficulties people have with digital access, it pushes me in a direction that makes me become quite defensive. And the whole of the profession at present is in that stance. We have a mixed economy of practices and a mixed economy of primary care, and I know you come to the LMC and have discussed some of the issues in the past there and helped develop some guidelines about how to access services. It's probably important to state that within the GP contract, we are now contractually obliged to move to an electronic way of accessing our services. So pushing, which is how it's perceived, people down a digital access route is actually a contractual obligation of our services. And not every general practice wants to do that. So you will get a variation between practices of how they perceive internally whether it's a positive or a negative thing. Some practices find it actually a very efficient way of dealing with a large volume of things without necessarily using a precious resource in the same way as it was traditionally used. Other practices, for whatever reason, don't see that as a necessary thing. So I'd probably just want to make sure that we invite you to come and talk to us in the different primary care forums that there are, to ensure that we work together with the patients around a sort of shared understanding of what the issues are, so that we don't end up in a polarised viewpoint at the start.
I think that's absolute, and that's why I want to work with the practices where we're getting lots of praise for, because I think that's really, really important. And I absolutely agree, because I think when we haven't launched the project yet, but when we do, I think it's going to be really important that we think about how we then use that information, as we do with everything, because there's no point in us gathering it, as you say, if everyone's just going to go, this is not good.
And I think it's very important that somehow we get our population to understand why the situation is as it is, and that it's not necessarily primary care trying to make it harder to get at our services, which it certainly is not. It's about trying to get everybody to move to a place where they can get what they need from the service.
Yeah, and I think that's almost written the preamble to the report. or the actually for the survey as well. So I think you're right, because as you know, I've always thought that our reports are about that sort of dual bit of saying this is why as well as this is what's happening. So I definitely want that bit about the contractual bit in there, because I think that's really important. But what I would say is that people who have people saying to them, I'm having a problem, or this has been really good, make sure they use our survey. Make sure they come to us with that information, because the better information we've got, the better decisions that can be done. So thank you for that.
Thank you. Audrey, please.
Thank you, Chair. So two things from me. One thing, Derry, probably as a very recent patient, my feedback is in there. So it was very easy to access. There were very straightforward questions. It was all digital, but that was great for me in terms of that overall. So just from a perspective, it is very interesting to see it from that side of the bed, if you like, rather than and not an entirely positive experience, but I did feed that back in. But secondly, most importantly, to pick up particularly around that project with schools, and that is something I'd like to take forward. It's one of our key areas moving forward. And using that exemplar is the best way, in the same way that I talked earlier with Abby around, actually, let's use the showcase to expand that into our services in NCC. Let's use that to see how we could use that, particularly either linked to curriculum, linked to the PSHE curriculum, or actually as a key priority that we want to take forward, because it is part of our priorities in education skills in Northumberland Children's Services more broadly, links across into children's social care as well as education skills. And probably some brilliant links in with family hubs, so that we extend it beyond school and into the family and community environment. So I'll definitely pick up with you.
That's absolutely great.
Kemi, please.
No, thank you for that presentation. Audrey's actually touched on something I was going to ask, and it's really good to see what you're doing, particularly with young people's mental health in schools. And what triggered me was, what about those who aren't in school? Homeschooling has become more common, particularly since COVID. Is that something you're looking at incorporating into the Health Watch work?
I think that is a really good point, actually, and I think it's probably not something that we've heard about. I'm just thinking about what the route would be for people to contact us. But I mean, parents who are homeschooling or whatever could be contacting us. We do work with the hubs, so again, we might pick up some stuff through that. But I'll go back and check if we've actually picked up any stream of feedback about that. But it's a good point.
Audrey, please.
Just to come back in again, that's a really good shout, actually, Kevin. And so Debbie, there are a number of mechanisms around my team, so my virtual school head and the work that we do there, how we develop that out more broadly with our health partners, so we do quite a bit of work. I think we should join that up. Kevin's right, the electively home educated population is increasing. but actually it's broader than that because it's also the alternative education population that's increasing as well. And as we see, we've got a decreasing picture around permanent exclusions in schools. That's a bit of a teaser ready for the annual education report that will come at some point. However, they are still far too high. And so actually, you know, we know from the evidence and the data that they can be some of our most challenged young people and some real complexities that quite often Janet and Kevin and I and our wider service teams are engaged together to try and solve. So I think that's another piece that we must join up and think about how we reach into that population more. And Derry, maybe some of that is we help you to reach into that population objectively on
That's
our behalf.
absolutely. And I think I've just put down the phrase unheard community.
Yeah.
And I think that's probably another way. And we always need partners for unheard communities, don't we? Because that's the issue. No, that's really helpful. Thank you very much.
Laura,
Thank
I'll
you.
come to you then.
Thanks, Terry. I suppose more of a reflection from me, but as you said in your presentation, as an organisation, CNTW gets a lot of feedback from service users and carers, but we're aware there's an awful lot that we don't hear and we don't know as well. And I think our most recent meeting at the People's Advisory Committee really made me think about the impact of individual stories and the power of a direct voice. A lot of the feedback that we get is sort of disconnected and it lacks the detail and the context that helps us to understand. And I think, you know, CNTW is doing a lot of work at the minute around community mental health transformation. We're kind of working hard internally. And as a very large organisation, we're obviously trying to do things in a way that's consistent across all areas. But perhaps we lack an understanding of the impact of that in those more local areas. And I think that's really the value of being able to have that good relationship with Healthwatch and get those individual stories back to hear how there may be some unintended consequences and to be able to keep that kind of local nuance where we need it. So it was really just to reflect on that and the value of that really good relationship that we've got.
Thank you.
Abby, you want to come in?
It was just a comment. I think just based on what Audrey was saying before, I think we often are very reactive because we have to be. So we are reactive to feedback, but it's only through forums like this and through those relationships that we build that we can actually then be proactive, which is so critical, I think, to be able to build the intelligence and to be able to help to develop policy and strategy that actually makes a difference. So yeah, it is really helpful. And, you know, I think you made the point before, Paul, about how things have progressed over the last couple of years, and that's certainly, I think we can certainly recognise that, and having that voice here and being able to discuss and be involved in more and more things is really helpful. So thank you for that.
Any more?
Can I make one more point?
Please.
Yes. Yes, so thank you for all of those points, which are incredibly helpful. And I know that Hugh will be taking those back to the board, who ultimately set our work plan for us. One of the things, if you've not already received an invite to our annual meeting on the 12th of September, hopefully everyone, I know Abby's on the list, I've seen you on the list, but if you've not already received an invitation, then you'll get one through from today. We are meeting at Hexham Mart on the 12th of September. We are very pleased that we've got a really good broad lineup, which I think reflects our work this year. We have Joe Morris MP coming to speak, and he is a PPS in the Department of Health, so that will be really relevant, obviously. But we have a local pharmacist who's coming along to talk about Pharmacy First. And again, it's all about making those links with all of those bits of transformation and change that are going on. And we've also got someone from Adult Social Care coming along to talk about direct payments. So because we know that is a real tool and it's a real issue and it's something that people want to know more about. So that's going to be our information bit of it, really, isn't it? I don't know who's coming along from Adult Social Care, but whoever it is, we will welcome them. But you are all very much welcome to come along on the 12th of September, and I think we can continue those conversations that we've had today.
Okay, so thank you. Are there any? I have two questions to you, Terry. you know, you talked about digital push onto the GP access and everything. It would be nice to know, because I work in IT,
Yeah.
I understand, what aspects of digital push people are finding it difficult. You know, a little bit of dive down will be very useful.
Yeah, that's what
What
we're
I
hoping to
found
provide, yeah.
more often from my experience is that especially people, even young people or people like me, middle-aged, they're okay with the change, good system, they're getting used to it, and then the IT system changes. It's often people find it difficult to cope with that changes rather than the system in itself. And more often what happens, like for example, Cramlington Town Council, they keep changing their email domain. Cramlington Town Council, now it has become Cramlington TC, you know, like that. So these things really annoy everybody, and I'm sure senior citizens will be more, you know, annoyed, and it undermines that confidence. So it would be nice to have a kind of a dive down on what aspects of this one. And the second point is, you know, you have of course, you have a wonderful way of reaching people, understanding the problem, and then reporting it back, and then you are following it on, like audiology. I completely agree with you on audiology. I have 2 hearing aids on both sides. So this is, you know, the service went down a little bit. Now it is all right with the people in Northumberland. Completely agree. That's all very highly appreciated. So I just want you to kind of pay attention to how representative your sample size is. You know, sometimes like, are there equal number of men and women? You know, like prostate cancer. I was reading in a newspaper, prostate cancer service hasn't been good, or the past 15 years or something like that. I can't recall. So are there enough balance? And then because we also have the tackling inequality as a target. So it would be good if you pay attention to in your sample size, not just number, but is it reflective of the society? So that would be highly appreciated as well.
And that's certainly something which the board is very, very keen on. So if you look at our reports, you'll see that we, I mean, I think the thing to always remember about us is that we're not sampling.
Of course.
Yeah, I mean, you'll appreciate that as because we're not researching in that way. But I think one of the things that we try to do is try to focus our work, i.e. the unheard voices, where we're working, which particular parts. We're trying to make sure that we can, we do get a diversity of voices.
That's right, that's the word. You put it nicely, diversity of voices. That's the very important. Not the number of voices, but
the diversity of voices. No, and that's a good point. Thank you. It's always good to remind us of that.
That would be, these are the 2 comments, light-hearted comments, that's all. Anyway, thank you for all the good work you are doing. Hope your future or whatever the reorganization goes very well. Nobody knows.
We're here until the law changes, which, you know,
good.
So,
Good to know.
No, what, if anyone says to you, oh, Health Watch, that's gone. No, it hasn't.
No, it hasn't.
Basically, until I tell you that we're not here, we're here.
Okay, thank you very much. Yeah, we hear lots of rumors then. Okay, thank you very much. And I think we are moving on to the 6th item, forward plan. Please note the forward plan. If you want to bring in some issues to talk about, please contact us. We are here to do that one.
Can I come in on that?
Yeah, I'm going to address the next one. Is that the one you want to say?
I'm not sure what's on your next one.
This one, next meeting.
That's next
So,
one.
okay,
Yeah,
that's the thing.
That's fine.
Yeah.
You've got it covered.
Yeah, that's correct. So on the forward plan, next meeting will be a kind of a hybrid one. For 20 minutes, we will be discussing pharmaceutical needs assessment, very quickly, sign it off. And then there is a closed session where we will be working with development session. Will be there 11:25 in the same venue. Is that what you wanted to say? Or is there anything?
My anxiety was high because Jill's not here and she normally tells us what's going to happen next. But
Thank you.
She briefed you perfectly. Thank you.
Thank you very much. And I do not have any urgent business, but I just want to correct myself. At the start of the meeting, I said, agreeing the minutes of 10th April, but the last meeting was 10th July. So please stand corrected. Okay, with that, I think I conclude the meeting. Thank you very much all for coming. Have a very nice day. It appears to be a very nice day as well, and a weekend.